A very interesting and important clinical test of orthopedics in upper extremity. I'm sure you all can read it out. Book test, by the way, this is also called as Froment sign. So, guys, before I go further, I have to tell you that we have four thenar muscles: abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and the fourth one is the one we are checking here, adductor pollicis. So adductor pollicis is a thenar muscle. The nerve supply is ulnar nerve, and the job is to do adduction of the thumb. Ignore this image. Look at me. The job is to do adduction of the thumb. Imagine if this is a book. Imagine if this is a book. So somebody has done adduction of the thumb to hold the book. Now this is what the patient is doing. He's using his adductor pollicis, adduction of the thumb, to hold the book. Now the examiner comes and he also tries to use the same muscle and adducts the book. And now how do we do book test? They will all try to, both will try to pull it against each other, and the examiner is able to take it out. That means the patient's adduction is weak, adductor pollicis is weak, ulnar nerve is weak, book test is positive, Froment sign is present. Patient's ego is hurt. Patient is like, doctor, can we do it one more time? Actually, I was quite sweating in my hand. Oh, of course, we can do it again. Now, this time, examiner comes with the book, asks the patient to hold it with his adductor pollicis, but patient does a small cheating here. Rather than using his adductor pollicis, rather than using his adduction at the thumb, he uses this movement. He uses this movement. I'm sure you all can see, to hold the book. He uses, not, he's not able to use this because he have understood that he's not able to use it, so he will use this movement. So when he will use this movement, what is he actually doing? He is doing, if you can see, flexion at the interphalangeal joint at the thumb. He's also doing flexion at distal interphalangeal joint of the finger. Since that patient is using flexion at the interphalangeal joint of the thumb and flexion at distal interphalangeal joint of the index finger, patient is using two muscle. One is flexor pollicis longus, supplied by anterior introitious nerve, deep motor branch of median nerve. Patient is using flexor digitorum profundus, again hair supplied by anterior introitious nerve, deep branch of median nerve. What have we concluded? That if a patient has positive book test or present Froment sign, he is not able to do adduction of the thumb to hold the book. So as a compensation, patient will use FPL of thumb and FDP of index finger. So that means in a positive book test or Froment sign present, the muscle that you check is adductor pollicis. The compensatory muscle which plays a role is FPL of thumb and FDP of index finger. In a positive book test, the nerve that you check is ulnar nerve, but when it comes out to be positive, the compensatory nerve is anterior introitious nerve, which is a deep motor branch of median nerve. This will be very useful to all of you in your Viva, theory, and even entrance exam. Thank you.